Hello, my name is Dr. Abdur Rasheed and I'm a pediatrician and a neonatologist in Detroit, Michigan. Today I'm going to speak to you about the importance of quarantining after a confirmed or presumed exposure to coronavirus or COVID-19 infection. One of the tests used for diagnosing COVID-19 is a PCR test. It is a very accurate test that looks at the genetic makeup of the virus. Quarantine as a means of virus prevention means staying at home, restricting oneself to 1 or 2 rooms at home, and not running errands. We know from the previous studies that the incubation period, which is the time between exposure of the virus and the onset of symptoms, for COVID-19 can be as long as 14 days, with a median incubation period of 5 days. A recent study published in the medical journal Annals of Internal Medicine in August 2020 and later quoted in a November 3, 2020 CNN Health article linked in the description, looks at the false negative rate of PCR testing. A false negative test means the patient is infected with the virus, but the test comes out negative for it. The study shows the patient tested by PCR on day 1 after exposure had 100% false negative results. On day 4, the false negative rate was 67%. On the day of the symptoms or day 5 of exposure, the false negative rate was still 38%. It further decreased to 20% on day 8 of exposure, which is 3 days after the onset of the symptoms. So what can be deduced from these results? The reason for the false negative test may be that the virus load is low at the beginning. The virus takes time to replicate in the body to detectable levels. A person can be infectious and contagious even if the PCR test is negative. It may not be appropriate to test up to 3 days after exposure due to high false negative value of the PCR test. Probably the best time to test is on day 3 of symptoms or day 8 of exposure, when the false negative rate drops to 20%. One reason that the virus is spreading is that, for example, when an exposed worker tests negative, they may be cleared to come back to work. Or as a second example, if a patient in a hospital tests negative, other people may stop taking precautions around that patient. This, if done in the window period, could lead to more transmission that would be preventable. If done properly, a 14-day quarantine is sufficient and may not even need a test. A PCR test should be done intelligently and may be as a complement to quarantine. So, for example, before visiting an elderly family, which is a high-risk situation, if you have a reasonable risk of being exposed, a 14-day quarantine is the best move. According to article referenced before, for a low-risk situation, a 7 to 10-day quarantine accompanied by a negative test may be enough. However, according to Dr. Lauer from the study quoted, there are no guarantees. With the recent holidays approaching, the Center of Disease Control suggests best celebrating virtually online. You can exchange Thanksgiving dishes in such a way that contact is minimized. Small sacrifices made now will ensure everybody will be healthy and celebrating the holidays next year. Please remember to reach out and listen to your medical provider if you have any questions. Have a safe Thanksgiving holidays.